my name is Dominique Fons. I'm a family physician from Central Illinois, and I want to talk to you about patellofemoral syndrome. It's the most common reason people, young and old, have knee pain, and so I wanted to show you 2 exercises to help your knee pain. A lot of my patients forget their exercises after they leave my office, and so I think it would be beneficial for them to view this before they do their exercises and during your exercises to help guide you. So what I'm going to also focus on is a little bit about the mechanics of what's going on with your disease or syndrome. So the kneecap or the patella, the kneecap is like a fulcrum for your muscles in your thigh. And the muscles on the outside of the thigh are too tight compared to the inside of the thigh. So it pulls the kneecap out to the outside. And every time your kneecap goes out to the outside, when you bend your knee and extend your knee, it will move out of the groove that it wants to be in. And that will cause it to start grinding underneath it. And so it will cause a crunchy sound every time you bend or extend your knee. So this is going to help that pain, and it will also help decrease that crunchy sound. All right, so I'm going to start with the first exercise. This is a stretch for the IT band. The IT band is the iliotibial band, and it's a very tight, fibrous tissue on the outside of your thigh. So I'm going to start by reminding you to breathe, and I'm going to make sure that if you have extreme pain, you should not do this, or you should not bend over as far or twist as far. All right, so let's start with the first stretch. The IT band stretch is a standing stretch. You want to make sure you have some walls or some furniture around you so that you don't fall during this stretch. The key is the stretch and not pain. So a little bit of pain is okay, but a lot of pain is not. So I'm going to cross one leg over the other. The legs should be straight, but not locked knees. So one leg is crossed over. You're going to bend down. Try to touch your toes, but don't force it. You're just hanging there as comfortably as you can. And then you're going to twist away from that back leg. Twist away, and then your weight is on that back leg. You're going to breathe in and breathe out. And when you breathe out, you can go a little bit further and twist a little bit further. And then again, hold the stretch. Never bounce with stretching. It can actually cause muscles to spasm. And then you breathe in again. And when you exhale, you can go a little further down and twisting away. And breathe in again. Again, go further. If the pain is excruciating or you can't go further, don't force it. And then when you do it one more time, breathe in and breathe out and go further. And then you can use the furniture to help you stand up so you don't tax your back. Then you're going to do this on the other side. You cross the other leg again. Know what your back leg is. You're going to bend down, try to touch your toes, and then you're going to twist away. Now notice one side, a lot of times, is a little bit easier for you to touch your toes than the other, and that's very normal. And again, breathe in, breathe out. Now all my weight is on this back leg. And breathe in, and twist a little bit further. You should feel that stretch right in the back, the outer side of the thigh, and sometimes into the buttock. And again, breathe in with your ribs, and out, and hold it. One more time, breathe in, and breathe out. And I just used my hands to bring myself up. So that is the IT band stretch. The next exercise I'm going to have you do is called the VMO stretch, VMO strengthening. That is called the vastus medialis obliquus. You don't need to know the name of the muscle, but if a health professional is listening, I thought I would include that. So to strengthen your inside thigh, what you're going to do is you're going to take your heel out, you're going to take your toe out. You're going to lift your heel with just about an inch above the floor. You're going to feel it right here in the thigh. Don't go out, don't lift too high. If you lift too high, you start exercising more muscles than you can actually cramp. So an inch off the floor. I do this for about 15 repetitions. I do this sometimes when I'm brushing my teeth. I will do this in the shower. It's really important to do this several times a week if you don't have pain and if you still have crunchy kneecaps. But I do this every day if I am having pain. Sometimes the amount or the strength of that, the pain coming when the kneecap goes back into its groove and out of its groove can be so intense that it will cause your knees to buckle. If that is happening, you need to do this strengthening 15 repetitions, 1 or 2 times a day for 2 weeks straight. Now I'm going to change feet. Again, heel out, toes out. You're going to point your heel to the front. And you want to focus on contracting this muscle right here in your inner thigh. You can feel that it's getting tighter. Again, 15 repetitions really makes a big difference. If you have any questions, call your doctor, or for my patients, you can call me if you have any other concerns. Your knee pain should start getting better within a couple of days. If it is not, and these exercises are not effective, you may need a brace. And then you need to call my office to get the specific type of brace. Thanks so much for watching, and I hope you have healthier knees after this. Have a great day.